Welcome to the Healthy Lifestyles Podcast, located here in Northwest Phoenix, Glendale, and Peoria. My name is Dr. Nick Hunter. I am your host, and I am a doctor of physical therapy, and I own and operate Preferred Physical Therapy, where we have helped hundreds of people aged 40 plus stay active and independent, live free from painkillers, and avoid surgery, even if they've had pain for years. This podcast is intended to help you make better decisions about your health so you can find joy in the journey by bringing together top healthcare providers, fitness experts, and nutritionists in the area to give you knowledge and confidence needed to make good health decisions. Thank you for joining us today. Welcome to the Healthy Lifestyles Podcast, located here in Northwest Phoenix, Glendale, and Peoria. My name is Dr. Nick Hunter. I'm a doctor of physical therapy, and I own and operate Preferred Physical Therapy, where we have helped hundreds of people aged 40 plus stay active and independent, live free from painkillers, and avoid surgery, even if they've had pain for years. I've written over 8 ebooks on how to treat common injuries and hosted numerous webinars, all in an effort to help educate the public on how to care for and maintain their bodies to live with joy, dignity, and without compromise. This podcast is intended to help you make better decisions about your health so you can find joy in the journey by bringing together the top healthcare providers, fitness experts, and nutritionists in the area to give you the knowledge and confidence needed to make good health decisions. Thank you for joining us today. And we are fortunate to have Kristen Bagley. She's an Arizona native and a Board Certified Nurse Practitioner. She graduated with her Bachelor of Science degree in nursing in 2012. After accomplishing a few of her own personal goals with weight loss, she desired to help others become their best selves. So Kristen returned to Grand Canyon University to become a nurse practitioner, where she graduated with her Master's of Science in Nursing with an emphasis on Family Nurse Practitioner in 2018. She is currently a member of the American Academy of Nurse Practitioners. And prior to joining Red Mountain Weight Loss, she worked in family medicine as she values the need for preventive health, encouraging wellness, and lifestyle modification. She has 10 years of bedside RN experience, having worked in the intensive care units, as well as preoperative and postoperative units. She's active within her community at Dead Red Conditioning as a lifelong member and prior coach. And in her spare time, you will find her at the gym, exploring the outdoors, traveling, and spending time with family and friends. Kristen, a joy to have you. Thank you. Is there anything you want to add to that introduction?
I don't think so. Thank you so much for having me. I'm excited to be here.
So I know we just went over the introduction. We got to know you a little bit, but tell us a little bit more about you. You mentioned in the introduction having a personal journey in weight loss and some of your interests and passions around preventive medicine and helping people make good decisions regarding their health versus always trying to treat conditions or treat diseases. Tell us a little bit more about what makes you passionate about this and why it's so important to you.
Initially, so in 2012, so personally, I have battled with my own weight and feelings around my weight and even body image for all of my life, I would say. In 2012, I was lucky enough to start at CrossFit, and I happened to meet the infamous Julia Larish. You may know her, you may not. And she actually taught me a couple things, gave me some really good advice at that time. And I was able to accomplish goals that I never had with CrossFit by like setting a goal and achieving it and realizing what that felt like, as well as separating nutrition from the gym, because there's so much of an all or nothing approach in so many people, and I was one of them. So about 2013, 14 is when I accomplished a few of those and decided that if I could do it, that I could help others do it. And I just wanted to help people along the way. And in order for me to be able to do that without being limited, I needed to return to school to be a nurse practitioner so I could prescribe medications and just encourage and find a way, I guess. And then what ultimately happened was I was then in family practice for the last 3 years, and that was great. Truly just returning to get my nurse practitioner so I wasn't limited in the treatment that I could provide. And then the family practice, yes, treating the diabetes, hypertension, all the things that come with carrying excess weight, and then just preventative health in general. So now that I moved forward and was able to get that well-established base of knowledge, because I wanted to be able to clearly prescribe appropriately and safely, I have been able to move forward to Red Mountain Weight Loss and now help individuals lose weight and accomplish their goals. And I feel with my experience and the things that I've learned throughout the years with my own personal struggles and of course my schooling, I'm able to help people much more.
Yeah, that's excellent. So in kind of your journey towards it, you recognized in yourself your own benefit, your own improvement, your own benefits, whether that was with health, whether that was confidence, some of your body image insecurities, like so many of us already have.
Mm-hmm.
But in your ability to kind of work through those issues and then see how you wanted to be able to help other people, you went on this path to get your nurse practitioner. You did a little bit of background in family medicine.
Yeah.
And now you're all in on Red Mountain Weight Loss. And what is it that you guys do at Red Mountain Weight Loss that's unique, or how does it work in a doctor supervised weight loss program?
Well, actually, so we are able to do, multiple things. I love Red Mountain and the fact that they follow through with their weight loss program. So we not only get you to be able to lose weight and accomplish your goals, we help you maintain and stay there as well. So that's one of the things that I do love about it. That and then just the culture in general. But in a medically observed weight loss program, we can place you in a very low calorie diet. We can prescribe you medications to help as well in regards to, we do offer the HCG. And then we also have just a macro friendly type of diet as well. And there is the appetite suppressants for those who need them too. So we follow along the encouragement that we're able to provide. People come in once a week for their weekly injections if they're getting those. They follow up with us once a month, and we help them along their journey in regards to the struggles. Most of us have done the programs and we all have a few tricks up our sleeves. So we are able to help in that kind of way as well.
Helping people with accountability.
Yeah, accountability as well as their consistency. So being able to stay on track. And even if you veer off track, we're able to help and guide you and of course encourage you to keep going, because truly not every month is our best month to be in a diet, not every week or day. So it's just one of those things that we're able to help people throughout the struggles, especially those who aren't like the type A that just get a program and follow the rules.
Off they go. Yeah.
Yeah. And then there's others who truly need that encouragement and need to check in with someone's, and that's the type of person I am. So I completely understand it. And that's, I think that's where we are able to excel.
Definitely. I think that's one piece that everyone who's tried to lose weight completely understands, and that it is one of those that you need to be in a constant effort to find success, whether that's the accountability from a doctor or from a fitness coach, or even a fitness partner that you work out with regularly. There's some level of external accountability that helps you find success in any kind of weight loss journey. And in this case, because weight loss is often far more complex than just calories in versus calories out, having someone like you and others that you work with at Red Mountain Weight Loss who can be a bit more in tune with what you need specifically, whether that's with injections or a diet restriction or calorie restriction type plan. And there's ways that you guys can identify that with the individual that you're dealing with at that moment, to then set up a program or a plan that's going to lead them to success.
Correct.
And when you do that and people do have success and they're losing weight, what are some of the health benefits that they report back to you? What are they noticing?
So many things. So it's wonderful watching people lose weight. First of all, they feel fabulous. Their energy levels are increased and they truly are glowing inside and out. On top of that, I've watched people come off of medications in regards to their blood pressure medications and also decreasing their diabetes medications. I'm sure you do know, for every pound, I believe the statistic is, every pound of weight loss that you do lose, you also lose about 3 to 5 pounds of pressure in your joints. And so many people have such decreased pain and their knees, their hips, they're able to go for their long walks again. And that is one thing that I've seen people glow with.
Folks in their 50s, 60s, and 70s who are
Yes.
starting to have some of those age-related changes to their joints, commonly known as arthritis. Like you're saying, you lose 1 pound of body weight, that results in 3 to 5 pounds. I've seen some sort of studies that say it's 4 pounds, 3 to 5 pounds of pressure off of those joints. We even saw in a 2017 study that was published in a radiology magazine, that was published in the arthritis magazine, talking about how they do MRIs of these folks with arthritic knees, and over a 4-year period, they've lost weight. They have less progression of their arthritic change versus those who have not lost weight. And that was over a 4-year study. So they're showing a significantly lower amount of cartilage deterioration or cartilage decline for folks who have lost weight, which is a huge thing.
Yeah. So I do feel that those are some of the benefits, as well as just the lifestyle changes that they're able to take with them for life. So you're always looking for your lean proteins, fruits and vegetables, and truly learning just the different types of the foods. It's just basic nutrition as well. And learning what is a carbohydrate, what is a protein, and what is a fat, and how do you balance your meals throughout the day. So many benefits, I feel, and truly in a weight loss program, as well as losing weight.
That's fantastic. Is there one or two people that you've worked with that have experienced a particular amount of success in your program that you just love telling their story or love sharing their experience with for any number of reasons? Is there anyone in particular that you can think of?
Well, I have a couple. There's always a highlighted patient who has been very successful on the journey. I did see a patient who had lost 113 pounds since March of this year, and still going strong and still doing fabulous and feeling great and happy. It was amazing for me to see. And then there are others who have done it a little more slowly with a little more of the flexibility in regards to the macro, lower calorie type of diet. And they feel great. They are just shocked that they could lose the amount of weight that they had, as well as keep it off, and just how easy it can be when you're just monitoring your portions and making sure that, I don't know, you park further away to get a little more steps in regards to the grocery store, and just how simple those things can be. And if you stick to them and do them on a daily basis, they are very beneficial and helpful, and you lose weight. So
that's fantastic. I just find it phenomenal in the sense of a program that exists to help jumpstart so many of these people who feel they're in a rut, or they're stuck, or they've tried everything and nothing is working. And then you're able to step in and help jumpstart their weight loss journey, offer them the education that they need, and then monitor them over time to help them stay accountable and retain the amount of benefits that they've received. Because what we also know is, especially in their 50s and 60s, the amount of inflammation that can exist in the body, just because we have more fat stores in our body. The more fat stores that we have, the more inflammation is released into our body. And 2018 article was published in an autoimmunity review that showed how when you have more fat stores and obesity, it activates and sustains a body-wide low-grade inflammatory state. And just by reducing a bit more of that body fat, overall inflammation reduces. So your autoimmune diseases, lupus, even Guillain-Barré's a nerve one. Mm-hmm. There's a few very common, even allergies to foods. Allergic reactions can be triggered by an elevated state of inflammation. There's just so many things side benefits that exist just by losing some of that weight. Mm-hmm. Now, what do you say to people that might be a little bit indifferent about their current weight status, but maybe they may think they're a little bit overweight, but maybe they're not quite in tune with how overweight they are? Are there any tests or anything that you would prescribe or help people to do to help them know kind of where they're at with what a healthy weight is for them? Because we know that not everyone fits into the BMI categories perfectly. And so are there other tools or metrics that you use to help measure and offer people who may think that It's not worth it to me to lose weight.
Well, as far as measurements go, I mean, I'm truly a big fan of checking your cholesterol levels, your A1C, just your labs in general to see internally, like
So
if you're,
blood work.
yeah,
And
blood work.
A1C, for folks who don't know, is the measure of glucose in your bloodstream, and it's over like a 3-month period of time. So it's kind of a snapshot of how high your blood sugars are in your system.
Yeah, how well your body is able to control your blood sugars, and that gives us an idea. And then if it's too high, then obviously we can be at higher risk of diabetes or we can have diabetes. So it is something that we do monitor. And those are just like the baseline things that you would do. So lab work in general, but truly measuring your waist. I think for women, it's greater than 35, and I should know this right off the top of my head, but maybe I have stage fright. I'm not sure, but it's greater than 35 and maybe 37 for men, or is it 42? But great
Between
measurement.
42 and 47, we'll call that.
Yeah. I don't think it's 42. I want to say, anyway, I can't remember off the top of my head, so I apologize.
So it's waist circumference.
Yes. In regards to finding whether you could be higher risk for metabolic disease in regards to having more weight on the body. Because we can all, I talk a lot to my patients in regards to, we all want to pick a number. We have a number that we feel great at, or maybe that we were at when we were age 20 and it was like our best. And we stick to this number, but truly it's not about a number. It's the lifestyle that you're living. Are you happy? Are you consistent? Are you comfortable in your skin? Is your health good in general overall with your preventative health? And obviously, like I said, lab work is good. You're not on medications. You don't have high blood pressure. So it's just a matter of just in a general health, not basically a number or a test to see where you are. It's your happiness. How do you feel each day?
That's an interesting perspective. I completely agree with you, because ultimately we're here to find joy. Like ultimately we're here to enjoy ourselves in a sense of being dignified in who we are and on a path or a pursuit of becoming our best selves. And if we ever feel like weight is an obstacle in that, or weight is getting in the way of that, then it becomes a matter of, is this something now I want to take care of? And there are, as we've already listed out, numerous health benefits, but ultimately it's that mental health benefit of, are you comfortable in who you are and being the ultimate you that you can be? And weight loss is one of those things. And I think you alluded to that earlier when you had that patient who had lost over 100 pounds, the amount of energy and just zest and zeal for life that they now have that was absent prior, but now is flourishing. It is one of those, as a physical therapist, one of the things that I absolutely love is seeing people who have been in chronic pain get some relief with care, and then finally start to be able to, whether that's go hiking again or go on walks with their girlfriends around their neighborhood, and just the amount of joy that they can now experience because they're not hindered by this chronic pain. And I'm sure you see some of that with weight loss.
Absolutely. Absolutely. And truly, it's not that you don't want to monitor your weight or your health in general in regards to the numbers. The BMI is a scale that we all know is flawed. So it's not entirely 100%, but it's a great range that we can look, when you come in for an annual exam and or just a medical weight loss appointment, we can kind of see where you do range, and we can just shift gears and make adjustments, and they can be small or they could be very large. But internally, how do you feel? How are you sleeping? How does your body feel? And like you were talking about, just the pain and being able to go for a walk, enjoy your kids, being able to bend over and tie your shoe. I mean, there's so many things that are included that we all can look at, not just a number. So that's one.
I totally agree with you. I had a patient, she was in her late 60s, early 70s, and she had to use a walker for knee pain. She came to me, and when I asked her what is it she's wanting to accomplish with coming to physical therapy, she said, I want to be able to get out of a booth at a restaurant. And I thought, well, that's interesting and very specific. And I asked her, like, oh, tell me, like, what happened? And she's like, I can't stand it because every time I go to a restaurant with my girlfriends or with my family and they sit us in a booth, it is just terror because I'm going to need help getting out of that booth. Yeah. And she hates the way it makes her feel. And I'm like, okay, I got it. And now I know exactly what we need to do in order to help you get better. And so everything that we did was to help her get strength out of these deep seated positions. And when she was
Yeah.
able to do it, she was just so thrilled
Good.
at being able to do a simple task.
Yeah.
You know, things that so many of us take for granted, but in her case, it was very specific. So it's one of those that I love working with people who have a specific goal or a specific outcome of what they wanted to accomplish. And in your case, I'm sure it's somewhat similar in whether they want to get to a certain size or a certain thing coming up. I'm sure weddings, you know, even for fathers of the bride or mothers of the bride or groom that are wanting to look good in these photos that are going to last for a long time. And it's important that they're able to feel as confident and as comfortable in their skin as possible.
Correct. I was going to tell you, it was 35 for women and 40 inches for men. So just so you know, I had to
Okay,
look. I'm
so a
like,
40-inch waist. Okay.
yes. Yes. So, and if you're greater than, then it means that you're at higher risk for insulin resistance. That can lead obviously to diabetes. You don't have to be diabetic or have diabetes to be insulin resistant, but, and that's just general health in a nutshell, I guess.
Yeah. Now, do you take that measurement from like just below the belly button? Like when you say waist, and everyone's got a little different idea about where the waist
Right.
is. So how would you describe where that 40 inches for men and is it 37 for women?
35 for women, 40 inches
35.
for men. Yeah. I will tell people to pick a spot, whether it's right at the belly button, making sure that it's a nice even range, just so they will remember exactly where they are doing it. Or to just take their thumbs and feel their waist, just the hip bones, and go right around there if they can find that every single time as well. But truly, it's just going to be the measurement that they can stick with and constantly find or consistently find, just to keep that measurement. You can always measure in 3 different places too, but obviously don't calculate those up, but just to get a good idea of the waist circumference and where it's at. So either at the belly button or just right where you place your thumbs, if you can feel your hip bones, right
Yeah.
around that area as well.
Okay. That's an easy landmark to remember.
And then it's also a great scale. I do want people to know, and I do tell my patients this all the time too, because, you know, scale is just a number. It fluctuates dramatically with sodium intake, stress levels, lack of sleep, and everything. It's not something that's consistent that we can base our true weight at. So for every inch that you do lose, it's equivalent to 8 pounds. And that doesn't always show up on the scale. So it's a great second measurement that people can monitor because they will be working so hard and that scale's not budging. However, their clothes are fitting so much better. So
Yeah.
just
Interesting.
tool in there.
Yeah. No, that's a good point because it kind of goes back to our BMI discussion about how it being used as an imperfect tool in isolation to determine obesity levels, where here's a range of tests that we're going to monitor. So blood work is one. So your A1C numbers, your cholesterol numbers, and then you're going to look at your waist circumference. 35 or lower in women and 40 or lower in men are where you want to be. And then the scale. How much do you weigh? And kind of a general kind of rule of thumb of maybe the scale is not going down you want, but the waist circumference is going down, your blood work's getting better. That's a sign of improvement. Like we're not too rigid around only seeing that scale number drop. But similarly, if we're saying maybe cholesterol and A1C numbers are staying the same, but we're seeing the scale go down and we're seeing waist circumference go down, like there's just different measurements that we can notice where we are seeing progress, we're seeing success and can celebrate those moments of success versus always feel like we're failing because the scale is not going down or the one metric that we're using is not going down when we have more ways to measure success.
Yeah. And that blood pressure is a big tool too. So do that as well.
Yeah, definitely. Blood pressure is a big one. Tell us a bit, what are some of the biggest challenges you found with weight loss in your clients? I'm sure many folks come to you after having tried many other things. What are some things that you have found to be some of the biggest challenges or hurdles to weight loss?
I would say consistency. And I think we can all struggle with that, most certainly. And then also I feel just the mindset. So when we are approaching a diet, or, labeling it a diet, if you will, because it is a diet program, but we look at the things that we can't have versus the things that we actually can have. And there's so much that we can have. So it's our mental approach and the consistency. And then, of course, stress. I mean, people's lifestyles, people are working all day, every day, plus getting their kids ready for school, picking them up, taking them to their sports. And so it's just time and taking the time to make themselves a priority. And I feel like that's a few of the hardest struggles that I see mostly.
So it's kind of that mentality of on the airplane and the oxygen masks come down. It's start reaching for the oxygen mask for yourself and put it on first for yourself before you look to help other people. Particularly in this case, we're speaking to a lot of moms who have over the years exclusively or most importantly taking care of everyone else except for themselves, and now they come to this point where we need to start thinking about your own health and not feel guilty about it and not feel like I'm not worthy of this, or by doing this I'm showing other people that they're not as important as I am. And I'm sure there's a struggle with a lot of people in that space.
Yeah.
Do you feel like that's one of the primary reasons consistency fails in these folks who are struggling with weight loss?
Yes, absolutely.
What are some things that you do to help people overcome that?
Truly just give them tools on grab and goes, from my own personal experience, or just things that we do have at Red Mountain that are available for them, like either protein shakes. We do have little snack bars as well. And then of course, guidance in regards to just some of the foods. Like, so if you can have hard boiled eggs on hand, if you just know that like a Greek yogurt, on hand, always have your fruits and vegetables prepared to be able to grab and go as well. But we do have to plan ahead, and I do tell people to take at least an hour or two on a Sunday and just prepare for their week. So that way they are ready, because what is the quote? Prepare or plan, but you probably know much more off the top of your head. I just saw it yesterday too. It was like,
if you fail to plan, you plan to fail.
thank you. Very simple.
No problem.
And this is one of those things.
Well, no, I think it's great because it's one thing you've heard about meal planning all the time, but if you just say, let's just create a new discipline, 1 hour a week. This is what meal planning for you looks like.
Right.
And you're going to plan out your grocery list. Here are some meals that you're going to plan out. But then what I also love that you just talked about was your grab and goes. I'd never heard of it called it's a noun. Here's a grab and go, like the things that you can use that you can get to quickly because you are going to be busy, that are going to be healthy, a good alternative to eating out or to grabbing the next salty and highly processed item. You're gonna grab something else that's going to be more healthy, that fruit and vegetable, or something that you've a yogurt, hard boiled egg, whatever it might be. That's going to be a better alternative for them to get them out of that rhythm of the eating habits that have caused them to be in this problem.
Right. And we do also provide a meal prep guide at Red Mountain. And then we also provide so many tools as far as even just stress related things you can do before you go to your fridge when you're having a craving. Go for a walk, visualize, meditate. You can do certain things, listen to a favorite song, but just to get past that trigger. And then also there's just the drive-throughs. So there are plenty of options that you can choose from if you are with the kids and you don't have time to cook dinner that night. There's plenty of options in regards to grabbing some chicken and vegetables. Granted, it's a little hard at times as well, depending on how hungry you are. So that's another thing that we talk about, is making sure that you are eating your meals throughout the day, because if you are just busy, go, you are going to be starving by the end of the night and much less ability to be able to control what we're eating. So there's a lot of
self-discipline plummets when we're tired,
yes.
stressed,
Yes.
hungry.
yeah, we become very weary.
Yeah,
Yeah.
that's a good point. So explain to me or walk me through, if I were to be a new client, how does this process go? Should I come with labs already done? How does a new client process or intake look like?
Um, you don't have to come with labs. You can just call our office and schedule an appointment at any time, and you would meet with any of our providers. And we walk you through the process. You'll see a video of our two uh, products that we offer in regards to a diet plan. And then the girls walk you through, kind of educate, answer some questions, and then we will come in as providers and discuss your health history, review your medications, of course, make sure, and just kind of see what your goals are, because truly what matters is your goals. So we want to match your goals in regards to, do you have a wedding coming up that you want to be prepared for? Do you have an event of any sort? Or are you just there to feel better? You don't care about how fast the progress is. You just want to be there doing something and checking in. So we go through all those things, and then we recommend which diet plan would be best and suitable for you based off of your health history and your goals. And then after that, we will check in with you monthly. If you are come in once a week and you don't have to schedule an appointment to do so, those are just walk-in visits, and those are for the fat burner injections. They also have the Fat Burn Plus, which has the B12 for a little bit of energy as well. So it really depends on the patient, and it's individualized in regards to the diet plan that would work for them or be best suitable for them. And then as far as whatever they choose to do, whether they're doing the weekly injections or just following in once a month, it's entirely up to them, but we're there and we're able to answer questions and guide them along the way. And when they're coming in for their injections, they're absolutely able to ask questions. And even if they're at home and just have a question, they can call us. We're happy to answer them. So there's so many different avenues, but that's pretty much what it looks like in regards to getting a diet plan that would be best for you. And then we guide you in regards to your follow-up visits and checking in.
So it's all part of that first consult where you identify or evaluate what are their goals, identify where they are, what are their goals, and then what plan is going to be needed to help them arrive at that goal. And there's a pace component to that, whether that, the amount of time that we have to reach that goal, or if it's just going to be more of an outward goal or lifestyle goal that we're wanting to pace ourselves through. There's plans and options available based on that. So it's interesting.
And we do provide a lab slip. So everyone does get baseline labs, so we can monitor those as well, and just monitor the progress each and every visit as well, and the guidance and support. So it's a great program.
Now, you say a lab slip, does that mean I'm going to go out somewhere to get labs done, or is that something that you guys do in-house?
Yeah, no, you would have to go to Sonoran Quest, I believe is where we.
Okay. So it's like a referral for labs to be done, and then you just go get them done. Okay.
Yeah.
Excellent. What's something that you tell your patients or clients every day that you wish you could just record and push play, because you say it all the time and just it's on repeat? What's something that you wish you could do? You wish you could record and repeat?
Oh, there are so many. One that I do say often is control the controllables. So when the chaos is surrounding us and we do veer off, the only thing we can control is our controllables. So if we are choosing our lean proteins and our fruits and vegetables, and you're having your breakfast, lunch, snack, and dinner, you're getting in your water, you're getting in your sleep, these are the things that you can most certainly do your best to control. And then the scale will follow. So many people are so frustrated with just a couple pounds of loss and I've been guilty of this as well. But truly, any loss is a great loss. Maintaining is a great thing. We don't always have to be losing. So it's just a matter of the lifestyle in general. But controlling the controllables, I do often tell people to find grace, give themselves some grace. And do remind them that not every month is our best month, and it's okay. We just dust off, pick back up, control our controllables. So I would say control the controllables.
That's great advice. It absolutely is true, because so much of where we find ourselves is a result of our decisions. And when we lose sight of what we truly have control over versus those things that we do not have control over, it's very easy to have elevated stress levels, higher blood pressure, and then we lose accountability. And when we lose accountability, we lose discipline and then lose results. So I think it's a great thing to be in constant conversations or regular conversations with our clients around.
Yeah.
Preferred Physical Therapy and the guests on this show does not recommend, endorse, or make any representation about the efficacy, appropriateness, or suitability of any specific tests, products, procedures, treatments, services, opinions, healthcare providers, or other information that may be contained on or available through this content. Preferred Physical Therapy and the guests on the show are not responsible nor liable for any advice, course of treatment, diagnosis, or any other information, services, or products that you obtain through this audio recording. For specific information regarding your case, please consult a licensed professional in your area.